Hey there, my name is Fela Abioye, and this is How to Corporate, my digital show about how successful professionals navigate career moves and money matters. Today's topic, how to maintain mental health with Dr. Kimberly James. So thank you, Dr. James, for coming on the show today. Mental health is definitely feel like has been a rising topic over the last, not even just pre-COVID, I feel like it's been a rising topic over the last several years, but definitely during this whole pandemic period of people having to, be at home for long periods of time, kind of be isolated and not doing their normal activities. So I definitely felt like this was a subject matter that I would hope people are already having with themselves at home or, in the workplace. But definitely want to have the opportunity to have you here to discuss it. So first and foremost, thank you so much for joining us. So Dr. James is a licensed psychologist and also a business owner, former professor as well. Definitely has more titles. I can't name them all, but she'll do a better job than I can with talking a little bit about her background. So Dr. James, could you maybe just introduce yourself a little bit to our listeners and talk a little bit about yourself?
Sure. Well, first, thank you very much for inviting me to the program. So I'm very happy to be here. And as mentioned, I am a licensed psychologist and have been for 21 years. And every time I say that, I'm like, it's been a minute.
Hey, listen, it's seasoned. Seasoned, that's all. Seasoned. That's the word you use.
That's right, seasoned. Yeah. And I love what I do. I love what I do. I'm very passionate about the field. Also, as mentioned, I've worked in higher ed and the mental health offices on different campuses. Many campuses across the country, including Madison, as well as two in the University of Houston system. I also served as a graduate life dean at Stanford University. So it's just been higher ed almost all the way, and working with not just undergraduate and graduate professional students, but also faculty and staff. So they were always bringing in a host of issues that really kept us on our toes, clinically speaking. And again, was very happy to be in that realm of higher ed. So as many people, I think we're going to get into this maybe a little bit later, kind of had a bit of a reckoning with the pandemic. Being brought home to work, I decided to make a bit of a career change myself and go into private practice and starting my own career consultancy business. So I'm working with executives and nationally and internationally. We can talk about that maybe a little bit more at the end around career issues. So career issues, psychology, bringing those together. Again, I'm very passionate about these, and just an added plug, my doctorate is in counseling psychology. And what makes us a little different is that we have a concentration in career counseling and assessment. So I've always had my toe in this water, so to speak. Yeah. And I'm very happy to be here to talk to you about this topic.
Okay. Awesome. So that's again, you, and again, for maybe I've been ignorant to the matter, but I never really thought about the aspect of mental health when it comes to work, so much, you kind of always, what's the phrase, work-life balance, right? That's always being thrown around a lot. That's the only aspect of mental health that I've ever probably associated, with it. But you go through the pandemic and you think about all the other things, all of the factors that kind of play into driving your aspect of mental health, and even just what's going on right now in the market with, kind of a lot of turnover. There's a lot of people who are changing jobs and thinking about other things they want to do because they've come to the realization like, man, this isn't it. Like this, my mental health is not in the right space with this role, with this job, and I can't keep doing this anymore. So I guess just with all of that, said, and, your, extensive background, how have you seen or the evolution of mental health, right? Just maybe not just in the workplace, but just maybe in our own view of what that looks like over the last, several years.
Well, I think the face of mental health is changing somewhat, of course, throughout history, and I won't go into the weeds like that. But I think there's been great effort on our part, and I think others have kind of followed our lead, so to speak, in destigmatizing mental health issues. I see younger generations coming forward and being very forthcoming about, hey, I'm struggling with anxiety here. Whereas 10 years ago, definitely 20, I think people of the same age group at that time would have been a lot more reserved in coming forward about what their struggles were because the stigma was so high. Although it's still there on some levels, and we will continue to, work on that issue. I think that's the biggest change in the face and the trajectory and how mental health is perceived by the public. We hear about it all the time. I think, like with anything, there always needs to be more clarity. I think people probably need to do more reading. Maybe some of us that are getting on panels and forums and on television more to explain things to the general public so they have a better understanding of, what this is about and most likely how to get help for themselves or someone that they love.
Yeah, no, that's, really well said. And I definitely agree with you just from the layman's view that we're having conversations that we weren't having before, for sure, over the last few years. And I guess, and maybe that's kind of a pivot to one of the questions that I had, which you kind of touched upon, is the negative stigma associated with admitting that you have a mental health issue. When you really think about it, it's like, why was that ever an issue, right? Why is admitting that I need help, right, or that I'm struggling a problem, right? But I think for a lot of reasons, sometimes we're hesitant to come forward because when we admit that, it's like, well, maybe I can't do my job, or maybe I can't do it well or efficiently. And now that's going to change the negative perception of how people view me, or, they won't view me as being responsible, or, maybe I was, gunning for that next promotion or that next role. And if I come out and admit this, it could negatively impact my career. So I guess maybe from that aspect, have you seen just in your own history and as you've counseled folks, how that has maybe played a factor in people's ability to kind of just admit that, hey, look, I may be struggling here, but I'm still hesitant to kind of release that information to my employer or anyone else.
Absolutely. I hear this all the time. Again, it's decreased somewhat, but it's still, coming out in sessions with clients working in all different types of industries. And for all the reasons that you named, how are my peers and my colleagues going to view me? For instance, is Kimberly really struggling with anxiety, or is this just some excuse and, she doesn't want to, contribute to the team? Also, the ultimate fear of, like you mentioned, once I come forward with this, what will be done with this information? Because psychologists, we're bound legally and ethically around privacy laws, right? So when you come forward with the supervisor or colleague, well, not so much. So hopefully it's a trusted colleague and a supervisor that can help you navigate what your duties are to adjust anything to help you out and help you towards success. But unfortunately, people laugh all the time when they say they ask us questions and our answer is like, well, it depends. So is this going to be a problem? It depends. It depends on the culture of the place. It depends on if your direct supervisor and colleagues view mental health in a certain way. It depends on how much PTO you have. All these, variables and factors come in or what's going to be helpful and how people can best support you. But a lot of people really do have that ultimate fear. Once I come out with this, will this impede my progress here in this corporation? here at this institution. When my name comes up behind those closed doors, and I know you know what I'm talking about in those meetings, and even with my mentor and sponsor in that room, my name comes up and I'm like, well, she has anxiety.
Yeah.
Can she handle these new duties and tasks? Can she handle managing a team now? How will that really impact
or even
progress?
Even if they overcome it, maybe they never forget, right? And now it's
They
like this
never
permanent
forget.
stain to say that this, that was 5 years ago. That was a year ago. I'm fine now. Why are we still harping on that issue, right? That's another piece that's just like, it's such a big issue to say, man, some people would just rather, keep that in, right? Keep that information in. I'm sorry, but, it's just.
Absolutely. You are absolutely right. And a lot of the extenuating circumstances kind of fall out of the story as time goes on. So it's not like, oh, they just, had a significant loss in their family. It's just like they were anxious. Can't they handle it? And it's like, well, there were some other, things going on for that person. But again, sometimes that gets lost in translation, so to speak, when we're talking about promotions and different opportunities in workplaces. So unfortunately, that does exist. So what happens is that then leads individuals to sit and remain quiet, not seek any support. And then it builds and builds to the point where they're not functioning as they would want to at work. And then that's often, not all the time, but that's often when we start seeing people show up in our practice. Things are not aligning. They're not moving forward. There may have been a couple of outbursts, and I could go on, but yet that's when they may come forward and say, I do need some help.
Is there such a thing as raising your hand too early, right? To say, maybe I seek help, but maybe I don't admit that at work, right? Maybe it's, related to, I don't want to say anything at work, but I'm gonna go get help from myself, right? Is there a thing where you go too early, where maybe it's just a little, maybe you had a panic attack for the day, right? Or maybe just a little bit of anxiety for, a week or so, but is that such a thing, going too early to seek help?
Well, for us, there is no such thing as too early, to be perfectly honest with you. Please come early and let us, have that, initial conversation. Just say, hey, this seems like a one-time thing. I think you're okay. You can move forward, and I'm here if you want to come back and if anything changes, in that presentation. But I think it's for people to really understand that whatever they may be experiencing doesn't equate a Woody Allen film of psychoanalysis. Someone's on the couch for years, it's just sometimes someone needs a reminder, or they need to learn about some coping skills and strategies, have a better understanding of the link of how they see the world based on how their supervisor or their colleagues do, and why that conflict is coming up at work. And once they gain that, then they can move on, so it's not this, you're going to be in this year after year after year. And I think that stops people, unfortunately, from seeking services as well, because they think, I don't want to commit to that, and I'm not that, and I don't need all of that. But you may need something very short term that we could be very helpful with as well.
Yep.
So there is no too early for us.
Okay. No, makes sense. So, so going back to the working from home, right, lifestyle that many folks have either one may have been doing prior to the pandemic, but now have had experience in doing so now. What are your thoughts about the long-term effects of working from home? Is there a negative impact to that, right? I mean, let's just assume again, there's no real pandemic out there, right? But, a lot of folks are pushing that, hey, look, I really like working from home. I want to stay working from home. I don't want to continue on. What are your thoughts around that lifestyle and what that could do, or, maybe nothing, maybe the positive way or whatever for the mental health aspect of it?
Sure. So don't disconnect this meeting here. But as I mentioned earlier, It depends.
Yeah.
So I think for
Yeah.
some people, it can turn into, and you mentioned this earlier, where it can turn into people feeling very disconnected all the way to them feeling very isolated.
Mm.
So I'm working from home. While there may be some advantages to that,
Mm-hmm.
but I'm not really having those sidebar conversations and collaborations with teammates. Or I really can't just pop into my supervisor's office and really have a better gauge of my progress from working from home. I've had to adapt in a way that I'm not quite sure how to read this well, you know. So again, it really depends. Yes, some people have reported, many people, that they love being at home and they're able to just relax more. And you see a lot of folks who identify as introverted, those who, you know, are within their own realm and draw energy from that. And it's not that they don't like people. That's a misconception. Oh, introverts don't like people. They like people, but they like to have a bit more control on when they actually connect. And sometimes the work environment, you don't have that control. So they're loving working from home. You know, the more, the better. You know, the longer the time, the better. Whereas those on the other end of the continuum, because it is a continuum, that may identify more as extroverted, where they really draw their energy from outside of themselves, you know, from people and places and things, so to speak. Those are the ones that may start feeling very disconnected. And then again, isolated and not feeling that they quite understand and know exactly how they're doing and progressing in their work. Yes, they are in communication like this, but it's change clearly. And there's some of us that can adapt to change very well. And then there are those of us that cannot, those of us that have been given really clear directives on how to manage what we're doing and how to check in. And unfortunately, there's some folks out there who have felt that they have not been given that direction. So that starts to add towards the anxiety, depression, stress, and it can go in lots of different ways with health as well, and sleep patterns. And then we start seeing these kind of reports coming into, you know, an office like mine. So yeah.
Gotcha. So no, that's interesting. I guess I didn't think about it from a introvert versus extrovert perspective, right? So, but I mean, it makes sense. I mean, I think about myself, you know, my role is more so out-facing, you know, probably about, you know, 30% of the time. And I'm probably in the office about the other 70%. So, and I like working from home to some degree, but not every day. You know, not every day. I like the autonomy to be able to maneuver and do the things I need to do, but to say that I'm just gonna have every conversation I ever have through Zoom, through phone calls, you know, no in-person interaction, like that just drives me crazy. So, but the other people, they love it. You know, they want to be able to just, you know, come in, do their thing. Don't talk to me, you know, because you cut out all the sidebar conversation, right? When you go into the office. And, you know, some people don't like all of those, that, you know, that chit chat stuff. They don't like, nah, I'm here to work, you know? So, you know, but again, you know, when you kind of align it with the extrovert versus introvert personality, I think it makes a lot of sense there. So for sure. So, okay. So again, going around, keeping that same vein, and speaking for myself, I know working at home feels like you wind up working longer and working harder. Maybe not everybody can speak to that, right? But
I think that's being debated.
Yeah, I know, right? Yeah, right. Because you got the folks who are pushing like, no, you need to come to the office because you're not doing any work at home. And I'm like, man, I'm working. I probably work harder than I ever worked before because I'm working at home. And
exactly.
You know, so I'll guess maybe this question is for me and maybe not for anybody else, right? But you know, it feels like, you know, I've been working harder just being at home, having the ease of access, going right upstairs, right, to jump on a computer, et cetera, and kind of being confined to home, but for myself or maybe anyone else who can relate to me in that aspect, how do you think that plays a factor from a mental health perspective?
It skipped just a little bit at that very end. I'm sorry.
Okay, no, you're good. So I'll repeat that. So for myself and anyone else, right, who can relate to working from home and working longer, because of the whole pandemic, et cetera, and being remote, how do you think that plays a factor into like the mental health aspect of working from home, working longer hours and things of that nature?
Sure. Well, like I was kind of leading towards with the last question that you asked me, that people are trying to adapt with pretty much showing what they're doing, right? And some folks have a very clear understanding of how to do that, and others not so much. So what we're seeing and what so many are reporting is this burnout because they're working these longer hours, because they're trying to actually prove to others and show, here are the accounts, here are the receipts of the work that I've been doing, which leads to longer hours. And then that leads to more stress, because longer hours, what are you not doing when you're working longer hours? It's taking time away from family and things that we did, different activities, fun things with friends, family, whomever, to de-stress. Right. So that's where that balance, so to speak, starts to kind of go out the window a little bit. So a lot of people, again, are seeing different health issues, mental health as well as physical health issues because of these longer hours. And it's just the overall stress and pressure of feeling I'm being held accountable in a different way. And I want to say this, sometimes it is real. Okay, I want to make sure that, this is real. Sometimes you're getting that very direct, explicit message from your supervisor, But sometimes it's perceived. You haven't gotten that message, you may have even received opposite message or opposing messages that I see what you're doing, I see you're working hard, but it's that shift into no one can see me. I'm not in the office anymore, so let me put in more work to make sure that no one's going to, call me to question in a certain way. So, so that leads again to the burnout, the stress, sleep issues. We're seeing lots of increase in domestic issues, arguments, different fears. Whether real or perceived, how is this going to impact me? I heard that there are going to be layoffs. Am I going to be one of them? Because I'm one person and I'm really pushing to stay at home because I really like that. But is there going to be a problem? They're telling me it's not a problem, but is that really an issue here? So all of these fears and concerns and anxieties are coming forward. And again, some people are very adept at turning to others to self-soothe and to process these emotions and to get to a better place. And other folks, not so much. And it just builds and builds and builds.
Got you. Yeah. So with that in mind, do you feel like work culture or work environment is probably like one of the leading factors there, right? So because, you mentioned some of it may be perceived and some of it, maybe not so much, right? So if you're in a work environment where they said, okay, you're all working from home, but I want to keep tabs on you by making sure I know that you're actually working, right? So maybe that's, employers may be be the driving force to maybe some of these mental, health issues, right, that are coming about that they're not even thinking about that. Well, I'm just want to keep a closer tab. I just want to make sure I know what's going on. But like, well, no, you may be sending a unintentional message, right, that you need to show me what you're doing at all times, right? I didn't even think about that. I mean, is that maybe fair to say?
Absolutely. And work environment, I'll just start with environment. Any environment, outside environment, your home environment. There's just a plethora of very diverse research out there looking at all different types of environment and how they impact mental health. And one of my favorites is with interior design and mental health and bringing those two worlds together. Certainly you had designers and architects kind of looking at it on one corner of the campus, and then and then you had researchers, in the other corner, maybe environmental psychologists looking at it, but we're starting to see them collaborate a lot more as the years go on. So, and that's just one collaboration around environment and psychology or mental health. But yeah, this means everything. I've seen the same headlines I've had, I have, where people are feeling bullied at work or they're not feeling heard, because the very intrinsic need that we all have is a sense of belonging. We want to have that and to be heard. And if you're working in an environment that does not provide that for you, that can be quite devastating to your mental health. Even when it may be provided in your direct unit, but the broader organization does not provide that, that can be devastating as well, because your director of that unit can only go as far as, whoever they report to will allow them to. So sometimes you start feeling those constraints, and that can start building pressure and anxieties in individuals in the workforce. So environment means everything, where you're seeking that support and collaboration, and of course you are setting goals, and you want to reach those goals and feel really accomplished and good about that. But of course, everyone doesn't have that, and I'm not trying to really say that it needs to be every day. some situation, it's not going to be. That's unrealistic. But yet, overall, throughout your career, we're all looking for those kind of things. And sometimes in the environment that just is like, we're not providing any of that, it's just focus on the work, people are not feeling as fulfilled as they can. And then again, if they're not talking to anyone about this, it has a way of building and turning into something that can be quite devastating to someone's health, overall health.
No, so, again, a lot of really good key nuggets to keep in mind, right? When you're thinking about your environment, not just, the environment of working with your employer, but your own personal at-home environment, your health, all that just plays a factor, right? And you said something that made me think about, kind of in corporate America, right? And, it's this kind of this ever driving machine of just business, right? So, and I know you mentioned about working with, some folks international, right? I'd love to maybe hear your perspective, kind of doing a compare contrast of, what that looks like when people come to you for, about mental health issues that may be driven by work here versus maybe driven, for your folks internationally, right? I mean, do people feel more pressure here that may cause issues like that just because of the nature of corporate America versus how it is overseas? I mean, just wondering about your thoughts there.
Sure. Well, the individuals that I have worked with, so I can't blanketly, of course, speak for everywhere overseas, but it really comes down to culture, what that culture values and teaches and promotes within the workforce. So you have some countries that are what we would consider to be very generous with time, especially for new parents, and if you're taking care of an elderly parent, whatever the case may be, when you need leave, and you can take that leave, which is again the duration of time is quite generous. But also, what I've noticed is different. You can come back into either that specific, I should say, position or something very similar, and it's not questioned in a certain way. Whereas here, I think there are more pressures like, once I leave, it's going to be a lot harder for me to get back in, especially at the level where I was working before. So those kind of pressures in some cultures abroad just don't exist like they do here. So more of that is career trajectory, planning that out, and also management and interpersonal type of issues that come up overseas. But here it's around, I think, kind of going back to your last question, I think some focus has really shifted from business leaders, which is wonderful to see, on how they are really prioritizing mental health. I mean, it's just everywhere in just ways that we just hadn't seen before.
Sure.
And they're encouraging people, please take time. How can we help? Now, obviously, you don't know exactly how far that goes, and there are limits to everything. But what's really beautiful on the business leader side that we're seeing is this: we're going to do whatever we can to destigmatize mental health and to promote breaks and taking time and having that balance. So I think that's, just really wonderful to see as well. But again, looking at cultural norms, so to speak, from country to country, and nuances as well. And then of course, then you have all the variables that come into play. Like, is this someone that's new? They just graduate last year and they're new in the field, as opposed to they're managing others, and all of the things that come with that. So there are some similarities, everyone wants to get along and have success at work, but some of the foundational support networks are different from culture to culture. So it is somewhat different.
Yeah, no, it makes sense. Maybe any other trends that you see kind of going on, just, in your, daily practice. I mean, like I said, I know you can't release any, confidential evidence out there, but just wondering, are there any of the trends that it'd be helpful for folks that are listening to be mindful of, right? Because I think, just like we talked about, the fact that mental health has risen, I think, to the top of a lot of business leaders' conversation, has allowed people to, again, not only feel vulnerable, but also maximize, or even just know that the resource is even available, right? So that's even one, right? And then maximize the resource, and then hopefully educate themselves so that way they can identify that, man, I think I'm on my way to, I need to talk to somebody, or I need to, or I need to, de-stress, or I need to go for a walk outside, and kind of, educate themselves. Because again, I think and tell me if I'm wrong here, but it feels like just education is even just such a high piece of recognizing that this could be an issue. Let me get out in front of it. So I'm just wondering, from your aspect, are there any trends out there that you're seeing that, maybe we can just, talk through?
Absolutely. And these are general at any time, pandemic or not. I think things in the pandemic have just been exacerbated, right? But things for all of us to look out for is, your coping mechanisms, your day-to-day interpersonal conversations and collaborations. What's changing? What's not working? So when I say that, I think it's really important for people to look out for any signs of course, depression, prolonged sadness, crying spells. Now, a lot of this is heightened around evaluation times, so some people get some of that feedback that it's like, oh yeah, that was good to hear. But it can hit you in a certain place.
Yeah, it's true.
If you're noticing a marked change, like, well, I got some really good, strong, but good feedback last time, but this year, I'm just crying and crying and crying about it. What is going on for me? What has changed? Something that's subtle that comes up in people, I think it would behoove them to pay attention to, and that's concentration. Now, with anything that I'm talking about, talk to someone, talk to a professional so you understand where you're falling along the continuum. Is this something I need to be worried about or not? But this has changed. But just because it's changed doesn't mean it rises to the occasion, that you need therapy, prolonged therapy. But yet that concentration, you're not able to hold information anymore. You're reading the same material over and over, and it's just, you cannot retain it. You can't focus in meetings like you used to. That is something that's telling you that something's going on with your anxiety and stress. And I think that needs to be looked at a little bit more deeply. So as well as nervousness, irritability is another one. Like, you see sometimes, unfortunately, people at work that may kind of snap and be very irritable all of a sudden. And, people kind of huddle around, what's going on with Bob over there? These kind of changes, I think, definitely need to be looked at. And also, like I touched on before, real and perceived fears and anxieties. So if you're feeling like, I'm not doing anything well, it would be nice to sit across, of course, if you could talk to your supervisor and you felt comfortable, to really check that out. Is that just something I'm internalizing something here, or it's just kind of on me, or is it true? Am I picking up on something? But also to sit across from a psychologist to really talk about what is going on a deeper level that may have you stuck in that belief pattern and thought process. So those are the kind of things that come up for me. I think I mentioned some other things earlier too, like sleep. One thing I didn't mention is nutrition. How are you eating? So some people start eating a lot more when they're stressed or they're feeling depressed. Some people go in the opposite direction and eat a lot less. You'll start seeing weight gain or weight loss. So you kind of want to look out for all of these, like I said, these changes. Some may be a little more subtle and not really on our radar, but others will be quite noticeable and noticeable to our colleagues as well. Yep.
No, that's awesome. Honestly, it's again, it's just so many little things that you just don't think about, right? But again, it's the aspect of just being self-aware and just paying attention to those cues. And just as you were talking about a few of them, I'm just thinking about myself and even just some of the things that I've struggled with over the last couple of years, during this whole pandemic period. And, I don't know for anybody else, but the weight gain or weight loss definitely is one of those for sure, and snacking all the time, constantly eating, again, associating that with working longer hours, being lethargic, not working out the way I need to, and how that makes me more irritable, and this things of that nature. Right. So, but again, just trying to have a steady balance, is what kind of helps you stay in tune. I feel like, both physically and mentally, but
absolutely.
But I love these gems. I think this is stuff that hopefully if you're listening, writing this stuff down, I'm definitely going to go back and write this stuff down myself so I can apply. I'm applying what we putting down. So, I love that. So that's awesome. So, and I kind of touched on this earlier, but wondering your thoughts about just the shifting job market that's going on right now. There's a lot of folks, changing jobs or thinking about changing jobs, or resigning or whatever the case may be. And just wondering what the mental health aspect of it is. I know I kind of gave my thoughts on it earlier, but wanted to get your perspective if, you've seen any clients or maybe speaking about that or, maybe after seeing you, that caused a shift in them, a realization to say that, what, I'm in the wrong career and I need to shift. Like, what's your overall thought about that?
Certainly. Yes, I have seen quite a bit of this, and I've been keeping up, with the business literature and looking at just how many letters of resignation are sitting in inboxes or on desks, just waiting. With the pandemic, what that brought about was fear on several levels. And it's fear for our health and safety, as well as that time period of being in a lockdown. So now you're telling me I can't go anywhere, and I might become ill, And so as things started opening up, and even before so, but what we're seeing now as the end result of that, I think people are sitting back and they're asking those deep existential questions. Who am I? What do I want? What do I value in life? And I think when we're faced with fear of self, of preserving self, like the pandemic presented to so many of us, it pushes us to start asking those questions and to really think differently about how we're living our lives. So I think this dovetails very nicely into, of course, career, because we spend more time at work than with our families and doing other things. This takes up most of our time every day. So I think a lot of people were kind of shifting into that realm of, is this what I really want for my life? If I become ill, am I going to look back and say, I really wanted to spend more time with family? So I think you saw a lot of individuals along the continuum, those executives who had those wonderful packages to cash in and that security to say, I'm going to retire early because I want to travel and spend more time with family, maybe spend more time with my kids before they go to college. Then some other folks, maybe I want to spend more time with my very young children while I have it. I didn't know what I was missing. This is so sweet. I'm thinking about the one commentator, I think he was on CBS News, and his little girls, they came in during, an interview like this, and it was just adorable. I don't think he thought it was in the moment, but afterwards, the follow-up interview was just so sweet. All those cute little moments, I think a lot of people start realizing, I'm missing a lot. How can I balance this out? What can I do differently? So I think so many people are asking those, probing questions, and then, kind of hitting the button and saying, I'm done. And then you had the sector of the workforce who felt that they weren't seeing the equity and support that they really wanted to in their industries, and said, well, okay, I don't have this big retirement package, but I'm out. I'm done. I want to travel, I want to hike. I like having flexibility to do what I want during the day, and I'm just going to find something that fits into my life as opposed to designing my life around this job that I had before.
Yep.
So I think that's what's going on because of the stress, because of the fears and the anxieties that the pandemic brought about. Then people are shifting into, I have to get rid of this. I have to alleviate this. Now, for some, yoga was enough. There was a lot of puppy adoptions. I know I was on those pages, oh, that puppy is cute, because you're at home and, gardening went up. That industry just blew out of the water. People were ordering plants and trees,
at-home projects, all that.
Gardens. Cooking at home and just all these kind of things. So people were really cushioned with this kind of time and freedom. And they said, this is too good, and I got to figure out a way to work and do this. So that's where I think the mental health with trying to alleviate that anxiety and the pressures that they were feeling at work doesn't make it a bad workplace, but just for some individuals. And then shifting into, I think I want to do something differently. And then let me go ahead and type up that letter of resignation and move on.
No, that makes a lot of sense. I mean, when you're kind of forced to be one with your thoughts, right? Within the pandemic, you start to do a lot of reflection, right? And I would imagine that's happened a lot with a lot of people, and really thinking about, do I want to do this every day, right? Or and maybe, and maybe they've been unhappy the entire time, but you just feel like, what, man, I got to work. So, and I've been here for X number of years, so I just got to keep doing what I got to do. But but then you get that mirror slapped in the face to say that, well, do you? Right. So, so, at the end of the day, I mean, like you mentioned, we spend more time at work than we do at home. So I don't understand why anybody would work somewhere or be somewhere they don't want to be for a long period of time. Right. I understand if you got to do what you got to do, right. Take care of your family for the shorter period. But, long gone are the days of working in steel mills for, 30 years. And
absolutely. And I'm from one of those cities. So yes, long gone are those days.
So there's definitely opportunities out there. So, I think, again, just that's why I really enjoy this conversation. It allows people hopefully able to do a little bit of self-reflection for themselves if they haven't done so already. So, but are there any resources out there that people can or maybe that you can provide, right, for people kind of juggling just the pandemic, family and all that? And I know you kind of gave, a couple of things to do, but any other additional resources out there that it would be helpful for folks kind of tap into?
Absolutely. There's so many more resources. Again, like when you were asking me about trends and the shifts, in the field. So we're trying to make this so available for people because they saw this mental health crisis front and center. Everyone, all hands on deck. We have to do something about this. So there are plenty, and plenty doesn't even cover it. There's just so many resources online of even just directories of psychologists that you can find. I mean, you can just Google psychologist in my area and they will all pop up. So you can do a search. The most popular directory that's utilized nationwide is through Psychology Today. And what's nice about that, I'm on there. We have our bios on there. So you get to see a little bit about us and our background, where we went to school, those kind of things, but also more importantly, how we work with people, what theoretical orientation we, are working out of to help people get better and to reach their goals, as well as different populations that we specialize in and that we work with. So again, there are just so many that are out there, but I would just encourage people to just Google for those and give yourself the grace to try some folks out, so to speak. On paper, someone may look great, but it really comes down to when you're in that room with someone, whether actually physically or virtually, like I work, that it's a good fit. You feel comfortable with that therapist because you're going to be talking about some very personal issues, and you want to feel really comfortable and confident in that therapist. And if you don't, it's just not going to move forward in a way that you need it to move forward. So I would say that that's the first step. Is to look online for that if you're looking for a psychologist. Now, I could have started internally, but it's a little tricky again. Internally, looking at resources as employee assistance programs that a lot of corporations have, speaking to your direct supervisor, but you may want some coaching and support from a mentor or a psychologist or whomever, career, counselor, to really see the pros and cons of taking the internal route versus external. Okay. But I would say some of those symptoms that I ran through before a little earlier, if those things are really becoming problematic with your progress in your relationships, please, reach out for help and seek help from a psychologist. And again, those directories are just wonderful resources on there. And a lot of us these days are working across state lines as well. So if there are folks that, I'm actually, in a different state, like I'm in Indiana, I'm just throwing Indiana out there. But I really like this psychologist who's based in Texas. Well, you still give them a call because there could be a way that virtually you could still be working with that person if they have that specialty area or that glint in their eye that you really feel, I can connect with that psychologist. So that's what I'm thinking as far as resources, but there's some other ones, and I'm going to cheat a little bit because I like to always read the actual numbers. And that's when things have reached a level that you feel where you're in crisis. Nothing is working, crying, you're not getting out of bed day after day, not motivated, not eating. That's when it gets to the point where you might need immediate assistance as opposed to setting an appointment for later that week or the next week with someone. Mm-hmm. So I want to get those resources and make sure people have that. So just give me a quick second.
Yeah, no worries. Take your time.
Okay.
Yeah.
So the first one, which is so wonderful, and you know, every time I hear about businesses like this, I'm like, why didn't I think of this? But it's just awesome. A lot of times, especially in working in higher ed, I would come across students who just struggled with speaking to people. Calling, making appointments, coming in face to face. So a brilliant person decided, well, I'm going to come up with a crisis line for people to talk to counselors, but it's a text line. So you text, and I tested it out because I'm that's just how I roll, okay? Yeah. I wanted to see how does it work? Mm-hmm. Do they really get back to me in the time that they say, oh, it works beautifully. Okay, awesome. It's really brilliant. So it's called a crisis text line. And so you text the word hello to the number 741-741. And all of this is online. I think, you know, I can provide you, you know, with all the links,
I'll make sure all that's included
for your audience.
Yep.
But it's just brilliant. And like I said, I tested it out as a nosy fellow therapist,
hey,
you know, just to see,
you got to make sure, right?
How's this working? Because I like to explain to my clients, this is what's going to happen. And I believe the majority of the therapists, they're licensed in all different states. And I think the majority are master's level counselors. They are wonderful. It is just such a wonderful thing. And for those that are not as at ease with speaking to someone, they are very adept at texting, and this is very comfortable, and it's quick, and it's right to the point, and someone's going to get right back to you to see what the crisis is so you can get the help that you need.
Awesome. Okay.
And last but not least, I just wouldn't be doing my ethical duty if I didn't mention this, and this is not an easy topic or a topic that people like to speak about often, but with suicide. And unfortunately, some individuals do get to the point where they start questioning their existence here. Sometimes it could be based on workplace dynamics. Very quickly, I'm sure you saw where in France, I think they outlawed where managers can no longer text or call or email employees after hours because people were working longer hours. It was stressing them out. There have been a couple of cases in France. So with that in mind, unfortunately, there have been some suicides behind that level of stress from supervisors.
Yep.
So there's a national suicide prevention line, and I just wanted to give that number. And it's 1-800-273-8255. So those are some wonderful resources, I think, for your audience. In case, I hope they never do, but it's there if they need that level of support. And I just, like I said, it's never too early for us, you know.
Yep.
Please make those calls, contact, you know, a therapist and set that appointment and utilize the resources that are available to you so you can feel better. We're in the business of really putting ourselves out of business is what we say, because we set the goals. We want you to get better. We want you to have success in life and feel balanced. And then you utilize the skills that we teach in our sessions and you move on with your life. And we're happy to be there to help people along their journeys.
Awesome. No, hey, thank you so much. Those are, I'm going to make sure all these resources and the number and everything definitely is included. So definitely anybody listening out there, please utilize the resources that are available. So great conversation, Dr. James, for sure. I think it's very, very necessary, very timely, I think. And hopefully this will continue being a thing, right? It's not just an upward trend, but also just stays there for folks to just continue to stay aware. So thank you so much for your time. So I guess just as we close out, do you want to take a moment to maybe share a little bit about, just if you want to give anyone listening your contact information or about your business or as well, want to make sure folks can utilize you as well as resources too. So
Absolutely. Well, my business is called the James Consultancy Group. And like I mentioned earlier, I work with executives, managers, staff, it doesn't matter what level, but I do work with national employees, people in the workforce, as well as internationally. Some folks who really beyond require, demand privacy. So in essence, in doing some career coaching around a certain situation or consultation around a project that, they may be struggling with some internal things that are and issues that are going on for them that are getting in the way of that success. They actually like that I'm bound legally to hold their information private. So it kind of is an added bonus, so to speak. And like I mentioned with my training overall in counseling psych, it's been there since the beginning around career counseling and assessment. So it's just a passion of mine. And I love to focus on that because no matter what brings them in, the majority of my clients, whether it's purely mental health or, the career coaching and consulting, clearly with that, but career comes up because again, we spend so much time, at work. But I just love working virtually because especially internationally and time changes and things. I mean, obviously that is the best way to go. Yep. But I think even locally, here in Houston, you know how the traffic is. So I think people are really enjoying, I can just, close my office door or, however I'm going to do this, but I don't have to get in my car, go across town, sit in an office, and then go across town again to get back to work. Yep. I think this has worked out very well for, accessibility to mental health professionals and, career consultants and coaches like myself. So that's pretty much, what I do, whatever they're bringing in. It may fall more into the personal counseling realm, or it may fall into, coaching, especially for new managers. That comes up a lot, like, how do I do this? I have some concerns about it. So I work a lot with individuals as well as executives. Because as the saying goes, it's pretty lonely at the top and they don't have a lot of people to talk to or to speak about. And it may, again, the stigma in this sense, it may be frowned upon if your CEO is you're just struggling. Even though we're all human, right? Yeah. So, so that's what I do, again, virtually, and people can contact me via email, Dr. Kimberly James at gmail.com. Doctor is just DR, and we can get a conversation started and see which service that I provide is best for whatever issue you might be challenged with at the time.
Awesome. Thank you so much. Again, I'm gonna make sure all this is included in the show notes, but please, if you're listening, reach out to Dr. James, because clearly she can be of a great assistance. And I cannot thank you for your time today. Again, I think you've highlighted a lot of things that we kind of think of. Hey, thanks for tuning in. For more content, please click the subscribe button and follow us on all social media platforms at How to Corporate. Until next time, keep building.